Hello, hello, and welcome everyone. Thank you so much for joining us today. My name is Aidan Dowling. My pronouns are he, him, and I am the co-founder and chief advancement officer here at Point of Pride. We're excited to have you with us for this special conversation, which is part of our transgender awareness programming. This week is all about uplifting trans voices, fostering understanding, and advocating for greater visibility and access to care for transgender and non-binary individuals. We are grateful to have everyone here as part of this very important dialogue. Before I begin, I do want to put a disclaimer that this information is provided for educational and informational purposes only, and it is not intended as medical advice. Please always consult a qualified healthcare provider for personalized medical guidance. I'd also like to take a minute to introduce those who may not know what Point of Pride is or what we do. We were founded in 2016. Point of Pride is a trans-led nonprofit organization dedicated to providing life-saving, gender-affirming support to transgender and non-binary individuals around the world. We offer direct services through programs such as our free chest binder and GAF program, our HRT Access Fund, our Electrolysis Support Fund, our Thrive Fund, and actually open currently right now taking applications is our annual surgery fund. Our mission is to eliminate financial and systemic barriers to care, ensuring that every trans person has access to the services they need to live authentically and thrive. So let's just kick it right off. I'd love to introduce our guests for today's virtual workshop. So please all welcome Dr. Facque, pronouns he, him. Dr. Alexander Facque is a board-certified plastic surgeon with over 5 years of experience in gender-affirming care and is devoted to improving the quality of care for trans, non-binary, and gender-diverse communities. He performs gender-affirming facial surgery, chest surgery, and gender-focused body contouring for individuals of all identities. Dr. Facque completed medical school at the University of Nevada before being selected for a residency position in plastic and reconstructive surgery at Mount Sinai Medical Center in New York City. It was during residency that Dr. Facque decided to pursue a career working exclusively with trans, non-binary, and gender-diverse individuals, and he subsequently completed a fellowship in gender-affirming surgery with Dr. Lauren Schechner. Am I pronouncing that correct?
Sector, yeah.
Schecter in Chicago, Illinois. Dr. Facque spends his time indoor rock climbing, very fun, watching movies, and taking his Great Dane Finnegan for long walks on the beach. Love a Great Dane. How are you doing today?
I'm good. How are you?
I'm doing really well. Thank you so much for being here. So, as a reminder to everyone, we'll have time for questions at the end of this discussion. So please feel free to ask them into the chat or the Q&A box at any time. We have Tyler here from Point of Pride who will be in the chat if you he will be dropping any information that might be relevant to what we're talking about today. And then also, thank you so much to Rain and Nikki, who are our ASL interpreters here for those who need it. Awesome. So before we jump in, Dr. Facque, I just want to give a little overview of what masculinizing facial surgery is. So,
Okay,
and you correct me if I'm incorrect.
sure.
Masculinizing facial surgery is a gender-affirming procedure designed to create facial features more typically associated with the masculine appearance. For many transgender men, non-binary individuals, and gender-diverse people, facial masculinization is a critical part of aligning their physical appearance with their gender identity. The surgery can include procedures such as brow bone enhancement, jaw and chin augmentation, rhinoplasty, and cheek contouring. These changes can significantly reduce gender dysphoria, boost self-confidence, and help individuals feel more affirmed in their gender. How did I do?
Yeah, you did good.
Awesome. Well, thanks so much. Happy Trans Awareness Week.
And to you.
Awesome. So really just like curious, we heard a little bit about your background and where you went to school and where you had your residency, but all in all, like what inspired you to specialize particularly in gender affirming surgeries?
Yeah, I was really lucky that where I did my residency, midway through, the hospital, and in particular the hospital CEO David Rich decided to throw full effort into starting a multidisciplinary care center that involved surgery, medical care, hormonal, and and at the time there weren't like a lot of other academic institutions that were doing that. So Mount Sinai was kind of at the forefront of like a modern wave of academic institutions providing gender affirming care. There had historically been some places that then their programs like shut down, and it was largely performed in like the private practice setting. So prior to this point, like you said, I grew up in Nevada and then went to medical school there as well. And like I don't think, and I could just say I didn't have like a moment of education about gender diversity or transgender, non-binary identities. Like I don't even think that those were concepts. I think I like knew that there was trans people. It's interesting to think back at like myself with like where I'm at like now, but I don't think I had any understanding whatsoever. Other than like, yeah, I think a general idea. And so when I went into plastic surgery, I was interested in pediatrics. And I was involved in a surgery that we did like a forehead reconstruction for a little girl that was like 2 or 3 years old, and she had this like misshapen forehead, and we like took it off and then like reshaped it and put it back on, and I was like, whoa, that's like the coolest surgery. And then I thought about the impact for her, that she would have been like this little girl that would be teased and and had this like weird shaped like forehead, and now she's like not like, you're not going to be able to tell. So I really thought that that type of change result from surgery really like resonated with me, like something that you can really like see the difference. So I went to residency and then found that a lot of people get that training, but then don't use it. They just go into like cosmetic surgery because there's just not that many kids who need it. And so for one of like the first times in my life, I let myself get like discouraged and decide not to, do something. And I was kind of like aimless for a couple years thinking like, should I have gone into plastic surgery? Like, is this right? And then the hospital opened up the center, like I said, and it was really my friends at the time. They were like, "Hey, Alex, like this is the most excited that you've ever, been talking about your work once I started the rotation." And I was like, "Yeah, I think that I really like it." And then, as I like started to do like more and more, then I was like, "I think I'm going to do this." And then, by the end of my residency, when I, decided to go do a fellowship, I was like, "I'm going to do just this." And it's absolutely, made my career, like made my life. Um,
Mm.
I'm, just so grateful to be able to, work in the community, and that I get the privilege to do what I do.
So not expected. You went from, which I think most, I mean,
Yeah.
I'm sure you don't have to tell your age, but just in general, I think a lot of people didn't know much about trans folks, let alone if they existed, right? And it's like you went from learning about trans folks to now like you help, so many trans people every single year. It's a pretty big shift. But also grateful that you had an enlightened moment.
Yeah. Yeah, I obviously yeah, me too. Yeah, I don't mind saying my age. I'm 40, so like to think about like in my high school, like there wasn't even someone that was out. So, that I was like aware of. There was even a gay kid. It was, before not that like, trans representation has been on, film for a long time, in mostly like very negative ways, but it's like long before there was like Laverne Cox or these other, people that were, it was before like Caitlyn Jenner, like that was like a kind of like mid residency, for me. She became, she was of course like a, a public figure like before that, but became like a public figure as a trans individual where people started to like just learn, like what that meant. So yeah, definitely it's huge to think about that like transformation, and it relates to, facial surgery as well. I think we'll probably get into it in like subsequent like questions, but just like an involving understanding is, just been, it's like every day of my, career, like learning more.
Yeah. Yeah, well, let's get into it because I think the first question I want to ask is like, so I have been out for like 15 years, right? Like, and I I only have heard about facial masculinization surgery in the last, I mean, maybe 3 or 4 years, maybe, to be completely honest. So how long have you been performing them, and have you noticed a uptick, so to speak, in trans-masculine, non-binary individuals realizing that this is even an option? Like, I didn't even know that this was an option. I'd heard a lot about facial feminization surgery, and that was very common. But yeah, curious like how you've seen this uptick grow, and kind of like, is this actually something new, or has this been happening for like a long time and it's just now getting more aware?
Um, well, I definitely hear from the individuals that I work with, like a very common sentiment on the phone, or, when we're doing a consult, is to say that exactly that. Like they didn't know that this was an option. Probably somebody was doing it. I always joke, even that I'm not old. So find somebody older than me, they probably said that they've been doing it for 20 years. So I won't pretend like I'm, like the pioneer like that in the field, but it is true that it doesn't get a lot of attention. I mean, facial surgery as a whole doesn't get as much attention in the gender affirming, certainly like academic circles as like genital surgery.
Mhm.
And so I think just as a topic, the whole thing is kind of, I've kind of set aside. So when I was in my residency, we were doing, facial feminization cases, and I remember asking, well, like, why isn't there like a facial masculinization? And I got like kind of like laughed at a little bit because they were like, oh, they take testosterone and they don't need it. And not, I don't think they would have said like it was a sensitive like environment. So like, I didn't mean it like that, but they were like, those patients don't need it because they take tea. And like at the time, I was like, oh, okay, I guess because again, talking about like evolving, like understanding, that was a sufficient like answer to me. And it was only later when I started to work with more individuals, it was like, well, maybe they take tea, but like maybe they don't. Or maybe they
Mhm.
took it and they didn't like some of the side effects, and so they stopped, or they never planned to take it, but they have, different features that they want to change. So that was really kind of um, what got me into performing it, or being like open to it, was joining the Gender Confirmation Center where I work now. 'Cause at the time that I joined, it's a practice that's was created, and Scott Mosser was the sole practitioner for a number of years, and he really specialized in, I say like masculizing, like chest surgery, but like like mastectomy, and so he had a very large patient base of people that had had like mastectomies, and so he brought me on to like do facial surgery, like certainly like facial feminization procedures. But then we kind of assumed, or we were interested to know, that if there's this big kind of group of people that know about GCC, that have like, a trans-masculine or non-binary identity, that would be interested in this, if I would start getting kind of like more interest. And I think that probably because of that reason, like I probably do more. I haven't talked with a lot of like colleagues to know, but I probably do more than other people. But it's still definitely like in a minority of what is requested.
Yeah, that's interesting to know. I think that I'm sure that as people talk about it more, and more people get it, I can only imagine that the possibility will open up for more people. Um, uh, so I think that's great. I think it's cool. When you think about all of the surgeries that you do, what would you say are the most common? I know that most faces, like, it depends on the face, right? But what would you say are the most common things that people are looking to get when it comes to masculinization surgery?
Yeah, and it's an interesting kind of concept, that we could, enjoy talking about it, like kind of a higher level, to this idea of like facial feminization and masculinization. Because I've been trying to get like away from more like gendered terms, to accept that, like maybe someone's not like looking to be masculized or feminized. And so that's why, kind of going back to what you said, like people might not think that this is for them because they're like, well, I don't, want masculization. And it so to find a way to talk about it though in a way that like people like understand, and the not the like irony is like lost to me as a cis person, that I'm like talking about like how we should be like talking about it for someone that's like from the community. Like I'm very much like here to learn, but I try to figure out a way that we can talk about it more like inclusively, and to describe it in a way that answers your current question, which is like, what do people want to change? Like what you want to change could be like anything, as long as it's like related to dysphoria. And that's kind of how I approach it when I work with people, is just to say like, blank slate, blank canvas, what causes dysphoria, in what way, and then I can tell you like what procedure would be used to modify that, and kind of like what the anticipated result is. So to your question more specifically, the most common thing that I do is probably has been chin implant, neck liposuction, which can help outline the jaw. So you can get some more pronounced features without having to do implants, which is relevant, again, we'll probably get to, but there's it's a more complicated procedure with more possible complications. So people might want it, but they might not want to like have it once they learn about the risk profile. So
Mhm.
liposuction is like maybe a potential way that you can kind of get close to it, close enough to, help you in a day-to-day basis and not have to undergo this like bigger surgery. Followed by then rhinoplasty. And then the other ones that you mentioned, the like brow contouring and cheeks would be kind of like the least common. It's mainly in my, experience so far, it's been mainly kind of like lower face interventions. And then a couple people that want to get augmentation of their tracheal cartilage too, the like Adam's apple. As
Oh, that's cool. Yeah, I feel like I'm learning all the things because, like I said, like I didn't even think about this. Like, oh yeah, I guess you could if you could get it shaved. I guess you don't always think like, you know,
That one's tricky because it moves, and so as something
yeah.
like put it there and fix it because it's constantly moving, then the people that I've seen that have had it done kind of like elsewhere, it can like dislodge a little bit, and then you have to figure out like how to like stabilize it. So it's not as straightforward, which I think is it's another reason why you don't hear about it as much as when we're doing like facial kind of like reductive procedures, which are typically more like feminizing, you're like uh
Mm,
removing bone, and so you're not because you're not adding something in from like a surgical complication standpoint, there's not as much. There's certainly complications that are associated with feminizing facial surgery, but like if you're adding in like implants, those implants can, be in the wrong position, they can get infected, they can,
mm,
cause like fluid collections or something like that. So you end up I think probably overall a higher risk profile for the procedures that we're discussing. Even
mm.
though feminization surgery might be like a, 12-hour like ordeal with like everything like being worked on, it typically, you know, you don't have as much potential because of the presence of like prosthetics that we use for augmentation procedures.
So I'm hearing that the in most masculinization facial surgeries, you're adding things and that could put you at a higher level of risk. Is that what I'm hearing?
Yeah, because frequently what the discussion is looking to build like width or make like a shape that isn't there now. So you might
Right.
be talking about making like a more pronounced like jaw angle, either like more of a corner or have like, a wider face if the face is starting out more like narrow or round. Same thing with like the chin, you're like building your building structure. And so that's typically done with implants,
Mm,
especially if you're kind of like talking about the jaw. And so yeah, so because of that, and because you have like both sides of your jaw, um, you have the chance like maybe like the mouth position as being like a possible like risk as well. Cause you might have one side that looks good and one side that looks good, but they like don't look like, each other, even if they're both like fine individually. So that's
mhm,
you have like a cumulative risk because you might have like a risk per implant. And so if you have like a chin and this, it's not that it's like all the same risk. It's one, statistically speaking, it's like, additive or
mhm. Yeah, that makes sense. I also love the concept that you were saying earlier about trying to find things that are less like masculine and feminine, right? Like, and I heard you say a little bit of it, which was like, oh, like, like taking away, can give you some more of what we would normally, right? Like, say, like feminizing, adding on is a little bit more of that masculinizing. So I'm interested in the discourse of how the language will evolve that will be just more complementary to how people feel, right? Regardless of how they identify, and more of just like what you're actually doing as opposed to like, I'm gonna look like X, Y, or Z. Like, I'm just gonna look like myself, and this is the way that I feel I see myself and how I'm gonna alleviate some of that gender dysphoria that I'm feeling on the daily. Yeah.
yeah, that's definitely the goal as a provider, trying to, balance that. And I've gone so far, like in my office, to say like, hey, like take everything that says like feminization or masculinization or feminine or masculine, like off of the
Mhm.
documents. Like I don't want to see it. But then you get in this challenge because you have to have like words to describe something, like it can be really challenging. You might be like dancing around the word, but not saying it because you don't, want to, but then ultimately like, and also that members of the community like use that language themselves as well. And that's again what I'm saying, like, who am I to tell you that it's not masculinization? Like, you can
Right,
definitely,
right.
that's the term that you use, then like that's what we should use. It goes when I do a lot of chest surgery as well, like I said, from being in GCC, and we see it, or we're like when I first joined this practice, part of our website still had like FTM and MTF on it. And I was like,
Mhm.
Scott, girl, like you need to like that's got to go. But there's a lot of people, like I live in San Francisco with this like, hub of like, sensitivity where my friends that are not involved in this work like know that that isn't like the most up-to-date thing to say, but there's a lot of other places or people within San Francisco, and I pretend like it's not here too, where people use that, that terminology, like that's what they search for.
Mhm.
If they're going to go into Google, they're going to type facial masculinization. And so to be able to, you know, change it so that we're more inclusive, but keep talking to the people that we're trying to talk to. Like it's been a big challenge, but I do kind of structure it like you said, that I try to say like, brow reduction, brow augmentation, right? Jaw augmentation, like jaw reduction.
Right.
Just talk about like those procedures and then try to say like what they accomplish. Like rhinoplasty is like too generic, because it just means like just like the nose job. But yeah, I try to just stick to that so that, like you might be an individual that wants to have like, a more pronounced jaw and a less pronounced forehead. Like that's an option, an option too. So if we talk about like just procedures, then, I think we have a more of a chance to kind of like tailor everyone's specific result to them, which is, ultimately my top goal.
Right. Yeah, no, I love that. And that makes a lot of sense. What I'm curious, like when it comes to patient expectation. So here at Point of Pride, we think a lot about expectations and try to set them accordingly. But when it comes to surgeries, I mean, there's so many things that it depends on how the person heals, how they take care of themselves after, how the procedure itself goes. Like, how do you manage or help your patients manage their expectations, coming out of surgery?
Yeah, I love pictures. And I ask everybody if it's chest surgery, body, face, to like show me some pictures.
Mhm.
Uh, and for chest surgery, there's like different specifics to help me to kind of like hone in on these different things like nipple position or fullness or something like that. Or for facial surgery, to say like kind of like what would be like ideal for you to achieve, or like the anti-goal photo, like what do you not want to achieve in a modern day of like facial editing, like do you edit your photos? Like have you ever edited a photo? Like what do you do? Or like show me this edited photo of yourself, and then we can like talk about it. And it's not to say like, oh, frequently to be like, oh yeah, cool, let's do it. I'll be say like, hey, that's great. I love, this photo. Like, look at these features that, you've kind of like created. That's more than I can accomplish with surgery, and then
Mhm.
I try to maybe put it, it's like so subjective, but to put it in like a percentage of like, I can, do it with like, this much of what you're like looking for, like in that like edited photo. I feel like unfortunately, my answer to that is I'm like kind of like a downer, that I'm like, oh, I guess for these photos. And I'm like, yeah, those are amazing. I can't do any of that, you know? But it's actually kind of, it's almost like there's cases where that's true in like, feminizing surgery where, someone will have like just a bone structure that's just different than too different from what they're like starting with to achieve it. With masculizing surgery, I've actually found that the implants, because there's not implants that I'm aware of that are designed to this population. They're, made for people who've gone through a testosterone-based puberty, that the implants are really big for the people that I work with. And so in terms of managing expectations, like I have to warn people, like if we're doing implant-based surgery, it's not subtle.
Mhm.
And I've had, people that are like, yeah, I think I would just like, a little different. I would like to have my chin look like the way it does with filler, and I'm like, okay, great. I do too. I don't have an implant that can do that. Like it's a more significant change. So, Yeah, your question is totally valid. Try to do it with pictures and try to like, warn people that it's, in terms of like the implant-based stuff that it's like might be like more than they expect. Because I've had with masculizing facial surgery more than feminizing surgery, people in their immediate recovery time that are like, oh my God, what did I do? Like, I can't believe I changed my face in this way. And then they've been happy like 3 to 6 months out, but way more. And I don't think it's just like a selection bias if people are like coming to me more in this group. I think that there's like something about it, it seems, that is hard to
Mm,
adjust early on. And I'm thinking specifically of like buccal fat removal, which we
mm,
didn't mention in the other like surgeries, but that can help. Again, it's gonna like enhance the appearance of your cheeks and your jaw without actually, doing something to either. A lot of plastic surgeries like smoke and mirrors. But if you like take away volume from here, this will look more pronounced and this can look more pronounced as well. You'll have like a
right.
level round like lower face. And I found with like the buccal fat removal that people, at least like early on, are like, oh my gosh, like, what did I do? Like sort of thing. And then, but then long term, it like turns out okay.
Was the assumption there that like if you get, something in your jawline and you get implant in both sides that in those first like weeks you have swelling plus the implant, so now it might even look even bigger and you might be like, oh my God, what's going on? And then 6 months down the line you're like, oh, okay, I'm healed now. I'm, you know, getting into my post recovery and everything is feeling better. Is that kind of what you're?
Yeah, I think that's very accurate. And the swelling in the lower face, sticks around more than anywhere else. So someone might have had like a chest surgery, and like this is not gonna be at that level. This is gonna be like much more, and it's your face in a way that people like scrutinize their face in a different way. But yeah, I think it's definitely what you're saying. People, notice changes from their like baseline. Like, I always say with like chest surgery, if you're doing like a breast reduction, if one breast is bigger than the other, and you do the reduction and you make the small side bigger, that person, in my experience, will be more unhappy with their result than someone that's asymmetric, but that mirrors how they started.
Right. That makes sense. Yeah.
You have like a more narrow jaw, and then we do this big expansion. It's like, oh my gosh, like this is such a huge change. I find it seems to be more noticeable than people that are, doing the opposite, like reduction procedures that have started out with a wider jaw, and that's what they're looking to fix. And then they might be swollen on top of it. But me think, I don't know, because it'd be interesting to talk to a group of people that have like, had the surgery, but to know if like, there's something about that it's like more mentally, palatable, or, able to kind of like rationalize through as being swelling, or yeah.
Yeah. No, that makes sense. Um, When you think about like we talked about expectation management. I want to talk a little bit about recovery. So it sounds like the surgery itself is like really dependent on your personal needs and wants, right? And that there's many different options. Which again, it sounds like if I'm hearing you correctly, like some of them are more intense, like an implant, or there might be other options, like you were saying, like the filler with your chin. It's like maybe that's just all you need is just to keep getting the filler because that's actually what you like. um can you talk a little bit about what recovery looks like? So, can you eat? Can you talk? How long does this last? Like if I have a job, like how long until I can like show back up to work, so to speak? What does the recovery look like?
No, it's a really interesting um question. When I was like operating, when we were wearing masks all the time, I used to like kind of like laugh with my patients. They'd be like, well, now's the time to get it because you can just throw a mask on, and you have it on in your Zoom call and no one will question you. You know? Yeah, so what you said about the kind of like range of options is, absolutely true. And it is kind of like a, buffet that you can just kind of like pick like what you want. So the way that I work with people with that, I talk about options from like least invasive, or, kind of like easiest recovery, to like most like invasive, and that's when I also kind of put it in like percentage of change, to say that like if, filler is going to change your, chin shape by like 15%, but is associated with this minimal downtime, is that like enough for you? Is that good? Is that a payoff? Right. Um,
Mhm.
And so, because everyone gets to kind of like decide that for themselves. So to give all the different examples, yeah. So with filler, you come in, you don't get any, anesthesia. It's some discomfort with like the injections, but you're gonna, go home the same day. Your chin might be kind of sore for a few days. I've had
Mhm.
filler in my chin, so I can just speak from personal experience.
I
Um,
love it. Gender affirming care for everyone.
I
Just
know that
ev-
this this is what I say. So to say that you're like pretty sore and then it's, that's it. The swelling part of it is not like super noticeable. You are, but it's kind of more like incremental. When you start to do multiple procedures or have let's say have like implants placed, if they're things that are being placed from the inside of the mouth, so that would be like implants that are along the jaw here. You have cuts that are on the inside of the mouth, and it's not going to keep you from eating, but I think that it's realistic to think of yourself as eating a soft diet for like 2 weeks uh,
Mhm.
or so. And after that first week, you can kind of like I tell people to, kind of like use your judgment and see kind of like what feels okay. But incisions are well closed at that point and like the sutures are like dissolving. So, um, you are swollen. What I tell people with facial surgery is that for like the first 3 months, you're like outrageously swollen. You're well beyond like what your end result is going to be. And when you get to that like 3 month period, you'll look like you didn't have surgery and you'll be like thankful because you're like, oh my God, that's over. That's, typically the advice I give when someone's having like a bone reduction procedure. If you were having the implants placed, you would go back to seeing more kind of like what the shape of the implant is, but you still have to have the skin kind of like contract and tighten around whatever we're working on as the, swelling continues to go down. So you don't end up seeing your final result for like 9 months to a year after like
Oh,
facial
wow.
surgery. You'll see changes, but what
Mhm.
usually is like at 3 months, people are like, oh, wow, I thought that I was like, had all my swelling out by like 6 weeks. And then if I see them again at like 6 months, they're like, oh, wow, I thought I was like done with my swelling at 3 months. So you don't really like realize so much as it's happening. But then if you like look back or if you take like pictures, you'll be like, oh, wow, my gosh, I was still like so swollen. So
Mhm.
then when you get to that point, you start to have a lot less like noticeable changes. Back to your specific question. So that's like the whole like recovery like timeline. It's actually like quite long.
So like almost like a year.
Yeah, you should think of like if you have something that you're like following like on your face if you've had surgery, and if
Right.
you were leading up to a year, the chances are that your surgeon is going to be like, hey, let's let everything continue to like settle out to see where your final result is before we make some sort of like plan to address that.
Gotcha.
Um, in the immediate term after surgery, most often people take like 2 to 3 weeks off, and it depends a lot on what their job is.
Mhm.
Um, in that, first week, you could be on a computer. What I find is that people don't have like stamina for a full day of work, you know,
Mhm.
in within that first week, but like a few hours at a time would be okay, depending on the individual. Probably not one that you'd want to be like, on your feet for that, for probably like, 2 weeks. The
Mhm.
bruising should be pretty well resolved if it's present by like 2-ish weeks. So if you wanted to use that as a marker of like when can I go back to my like client facing job,
Right.
like 2 to 3 weeks. And that's what I find is like the bigger limiter is like not that people don't feel like they can work, but they want to wait until they're more kind of like presentable to do so. So if that's how you feel, then that would apply to you. If you have a job that doesn't interact with people, then yeah, chances are you'll, be able to, to go back sooner. But I think that, in terms of activity, I have people back to like regular exercise at like a month or 6 weeks
Oh,
after.
okay.
That's the point that you're like feeling like pretty normal at that point. I mean, you can go back to activity at 2 weeks after, but I'm saying like full, like unrestricted activity. So, um, so
Are
yeah,
you still numb? Like if you're like 6 weeks post, are you like still numb in those facial areas
yeah,
or
yeah, you might be. So if you're having augmentation procedures, the source of the numbness would probably be nerve stretch rather than a nerve that got cut in the procedure. That might be true. It might not be. That's very kind of like vague. But if a nerve is just stretched and it's not working because it's like in swelling or inflammation, then it typically comes back in like 3 to 6 weeks.
Oh,
If a nerve
okay.
is cut, then it has to like grow back to its target, and then that can be in like a year to longer than that. So you could very well potentially be feeling numb. If you were feeling numbness in your face at 6 weeks, like I would want to know so I could help kind of like, reassure or something like that, find out where it's at. But I would say that like that's still pretty normal to have. Numbness that's present at around like 3 months after would be more indicative of a nerve that was like cut and would need to kind of like grow back to its target, which is possible. People notice changes in their sensation, for a while after a lot of the different types of surgery that we do.
Interesting. Yeah. Well, that's good to know for those, interested, because I think like being able to take the time off of work and saving up for that if you have to, or if you have any type of, medical leave or something like that, you know what I mean? Kind of having an estimation of like, hey, can I take an extra week just so that I feel really ready? I love that.
Yeah, I
So
definitely tell people to do more. I'm like, well, and I don't know. It's like I
if
think
you
about
can.
that I have. Yeah, exactly. Like try to say like 3 weeks, and then if it turns out that you're like, bored at 2 and you want to go back, then that seems easier than trying to like prolong it, in my experience. But it's everyone kind of like knows for them.
Yeah, I imagine your work would be happy to have you back earlier than later. Um, I want to go back to what you were saying earlier about how you were saying that a lot of the implants used in these procedures are really based on, individuals who've gone through a male puberty. And I was curious when we think about just kind of like the future, right, of these procedures, as I was mentioning earlier, this isn't really I mean, I like maybe I'm getting older, okay, but I like to think that I kind of know what's going on in the world of trans stuff, particularly like trans mask stuff. Um, and this procedure has gotten more common in the last 5 years. 10 years ago, I didn't hear anything. So when you think about the future, like what would you love to see happen? Like I would imagine that maybe one of those things would to actually have maybe be different sizes of implants or something.
Yeah. No, I think that that's a great comment and question. I'll go back to say that you are obviously like, kind of like I think on the pulse of what's happening in like trans masculine communities.
I like to think so.
I guess I assume. And so yeah, I think that there's a whole kind of not like genre, I think it's like the right word to say it, but there's a whole group of like things that could help us in gender affirming care that we're like taking from the rest of the medical community that would be amazing to just have like made for our patients, whether it's like compression, garments for body surgery, penile implants, like there are things that were like designed for like other folks and we kind of like make do and use and they like, are okay in some ways and they're not okay with others. So that's a great, point that it would be nice to have like, the validation from the medical community to say like, yeah, we're making this like for you for this purpose. It takes, I mean, it's more of a like indictment of like of me because like I just need to go to this company and say like, hey, I want you to make an implant that's like this shape,
Mhm.
and that's I have like a catalog of like chin implants and they're like, they're all named after some surgeon. And that's like that person went to them and was like, hey, like I want this.
We get to have a brochure of just fake way, just like
Yeah.
what you got the fake way, Jaws, the
Yeah.
fake.
Totally. I wouldn't do it because my name's too weird, but
Everyone would be pronouncing it incorrectly, and you'd be like,
yeah.
"What is
They're
what?
like the Facque
Just call it
chin.
the Alex.
Yeah.
Just call it the Alex."
That's good. I think that's good, like marketing too. But yeah, so I think that, it's going to take the providers that work in that arena to say, like that we need, blank, that we need this. Um, I think, wanting for the field probably like this more information, kind of like you're saying, for people to know that this is an option. Cause I do have people that are really, happy with having facial surgery. And like you said, there's so many people that don't realize that it's possible or that it's something that like happens or something that they could consider. And there's so many different kind of like ways to do like what we're talking about. So there's, even though there's some facial versions of facial surgery are quite challenging to have for logistic financial reasons and otherwise, there's some things that might be within someone's kind of like abilities to do that can like help them on a very much on a day-to-day basis. Like we're typically walking around like with our faces out. This is why I wanted to go into and focus on facial surgery. Um, is, because to me it was like something that I thought was just like profoundly like meaningful. I know, it's a conversation again for not someone that's for not like a cis individual, but to say that like, having genital affirming surgery is incredibly affirming, for you because like that it's
Mhm.
there. One of the most common things that people say to me talk about being like misgendered in public and how they don't like want to have like that anymore. And it's like having your like phalloplasty is probably not gonna like solve that goal. I know I'm trying to say like the most like sensitive way like to describe this because I don't want to say that it's
Yeah.
not affirming, but that's not like what people are like, hey, I want to, try to have, I want to be, I mean, I don't hate to like, recognize like the truth of it. People like, I just want to have like a safer life when I like walk down the street, you
I
know?
mean, that is very much the truth of it. A lot of our recipients, particularly from our electrolysis fund, I mean, safety is key for many trans folks, and so I think that I appreciate your intentionality in the way that you talk and how you've talked this whole chat, and I think that it comes through. So yeah, I think you're right in that sense. I love how you said that your face is always out. Like, you wear your face out. Like, yes, I do. But uh, so thank you so much. This has been a great conversation, and we're gonna get to questions. So if you have any questions, as a reminder, you can drop the questions into the chat or the Q&A box. But before we begin questions, if you do feel inspired by today's conversation, we encourage you to make a donation to Point of Pride. Your support allows us to continue providing free gender-affirming services like binders, GAFs, HRT access, and surgery like facial masculinization surgery. You can donate at the link that Tyler is going to drop into the chat, or you can text one word trans futures to 44321. Every contribution does make a difference. So now let's jump into these questions. Are you ready, Dr. Fakeway?
Ready.
All right. So this one says, I'm looking over here. I've got my monitor over here. It says, as a gender affirming voice practitioner, I'm interested to know if trans masculine folks experience voice and resonance changes in terms of sensory or kinesthetic. Am I saying that word correctly? Kinesthetic.
I have to like look at the
I'm gonna assume that I'm correct.
yeah, probably
You are.
like kinesthetic.
Okay. Thank you. Awareness after FMS.
Yeah.
So
Um,
do you need me to say it again, or can you?
no, I got it. So well, I think I got it. Good. I thought this first question's challenge. So, in a way that people get like vocal cord surgery, they get like specific changes to their vocal cords. For those that are looking for like a higher pitched tone of voice, um, to my knowledge, there's not an equivalent of that is a procedure that gives you a deeper voice. I know that people experience it with hormone administration. Um, I don't know because I don't prescribe it, but anecdotally I've heard. And so in terms of the procedures that we do, none of the procedures that we've discussed should have an impact on your vocal cords. If that happened, it would mean that something untoward happened with surgery because everything that we're describing is all external from the larynx, which is where you speak. So even let's say you were to get like an augmentation of your tracheal cartilage there, that would still be on the outside and you wouldn't want to be affecting the inside structures. So I would counsel no, it shouldn't have a change in voice. Uh-oh.
I muted myself. Awesome. Thank you so much. I'm clicking through trying to get to questions, so I think that's why. Um, have you ever seen FMS? Do you even use that? I know we use a lot of like FFS to use FMS. You
Oh
use
yeah,
it?
that fun stuff. Yeah.
Okay.
Yeah.
Have you ever seen it covered by insurance?
Yeah.
Yeah.
Yeah, definitely.
Okay.
Think that like, well, I mean, it's got to be like per insurance and like per your plan. But if there's like an FFS that's covered, like there should be like, FMS as well. basically to like stop it, to not use those acronyms to be clear, but like if they're, paying for versions of gender affirming facial surgery, then you should be covering the ones, kind of like all of them.
Mhm.
The conversations I've had when I'm doing like, appeals and stuff like that with like those providers is like just trying to get them to admit that there's like differences in the way that like people's faces look. And so I'm like reading reminded of those conversations when times when they're like not covered. But yeah, I can absolutely say that it's been covered in my experience.
Awesome. Well, that's exciting to know because, again, learning something new, which is why we're all here today. Amazing. So, it's someone's just adding some context that there are some people who get fat injected into their vocal cords to thicken them. Have you heard of this before?
I haven't, but yeah, that's the procedure for making your, and this is, I don't do that. This is like in the work of like a like an ear, nose, and throat doctor, like a laryngologist. I just know about it from like being in the community, of providers, to say that the surgery that helps your voice be like at a higher pitch, like tightens the vocal cords, makes them more stretched. So yeah, so the opposite to provide more bulk, which you could do like with filler. Fat would be like permanent. Uh,
Mm,
I've never heard of anyone doing fat. I have heard about filler, but I've heard about filler in the sense of someone that has like a vocal cord paralysis from like you name the source, and they fill the other side so that your vocal cords can still meet, so that you don't always just like escape air, because they do close sometimes intentionally for different reasons. And so you want them to be able to do that. So if you did that, you know, you um you could have that. But again, and this is, I want to give that disclaimer. We said at the start that like this isn't like medical advice. This is even further from medical advice because this isn't my field.
this is just a general idea.
Yeah, but
Maybe.
what they're saying is true. You could, by injecting the cords, you could make the person have like more of like a huskier voice.
Hmm,
It would be less air would be like escaping.
interesting. Um, all right, we've got two more questions. So this question came ahead of time where people were able to ask questions ahead of time. So the question is, how common are revisions in this surgery?
Yeah. Um, Personal experience is that they've not been, any higher than any of the other types of surgery that we do, that consider that in like it's like a 1% type of range. Um, I based on numbers because it's such a smaller group, it's hard to know. Like I personally, knock on wood, have not done a revision yet for the people that I've done any of these procedures on. But acknowledging that it's a smaller group, such as a smaller like sample size. So I would say to consider it, even though it is, higher risk, the risks are still low. And, to think of it as like, somewhere between your individual risk is, going to be maybe like somewhere between like 1 and like 10%. It's kind of, risk is an interesting thing because you can hear the statistics, and if you're the one that like, has it happen, then it's like 100% of your experience. So it doesn't matter that it only happens to like 1 in 1,000 people. But
Hmm.
yeah, I would say to think of it as like, by that kind of like way to think about it, like more of like a 1 in 100 sort of like situation. I do counsel people though, and another reason why maybe less people like decide to have surgery, I do kind of like to paint a more like bleak picture so that people are like prepared for negative outcomes, so that it's not like a surprise. It might be kind of like scaring people away, but I do say that that cumulative risk, might be like 3 to 5% like per like implant. So your total risk is like 10 to 15%, which from a risk perspective is like high, because everything else we're talking about is like 1 to 3. But in my actual practice, it's like way, way lower.
Yeah, no, that makes sense. I see. Sorry, I'm just going through the chat here. So here's our last question, unless we get one more that pops up, which I think goes to what we were talking about a little bit earlier, about how like it's becoming more common. This question says, what's the most challenging element at this time for getting the word out about this surgery? Do you
Uh,
even have trouble with that? Like, do you have like lots of people coming to you and this is not actually an issue?
no, yeah, I'd say I don't have compared to like the other types of surgery I don't have a lot of people coming to me for this. And I would say that because in a general sense, like this is going to sound kind of like snotty, but like I don't really do a ton to like advertise at all. Like it's all through people kind of like talking about it on like message boards like Reddit and Facebook
Right.
and stuff like that. And I think it's just because not that compared to think about, if they do like, top surgeries, like multiple top surgeries a week, and you have that many people that could potentially be like, if some small percentage goes out and shares your experience, you just have a whole bigger number to choose from. If I do, like, I typically do facial surgery like 2 to 3 times a month, and of like of this type of facial surgery, it's typically like once every like 3 months, and so there's just less people out there to like share their experience.
Yeah, that makes sense. So Dr. Fakeway, do you have time for one more question?
Yeah, for
Okay.
sure.
So this question is, if you get, I try so hard with words. I really do. If you get buccal, that's
It's buckle, but
buccal.
everyone says buccal. That is like 100% of what I hear, but it is technically buckle.
Okay. If you get buccal fat reduction or neck liposuction, if you gain or lose weight, will your results change and will you need to do it again?
Yeah, that's a great question. I love to answer it because it also works for body contouring as well. It's a good thing to understand. Um, the way liposuction works by removing fat, that's not like a shocker, but when you're taking out fat, you're taking away those cells as well. And the way that fat grows is that like cells, you don't first make new fat cells, you expand the ones that you do have. And then if you get enough kind of like fat gained, then it will like divide and make a new fat cell. If you lose weight, then those cells just shrink, but they don't go away. So you'll always have like more fat cells that could potentially expand. If you get liposuction, you actually will remove those cells. So if you gain weight, you're not going to gain weight where you've had liposuction. And which is why people will sometimes say, like, oh my God, I got lipo. And then like my thighs got big. And it's like, that's not what happened. What happened is that you like maybe lost some weight for surgery and then, gained it. And so then you had a place that was able to, get bigger like fat cells, more fat storage. With, these procedures with losing it, you can still, if gain enough weight, you can go back to kind of like what your anatomy was before, but it wouldn't be, in my experience, it wouldn't be the first thing that happened. Um, Buccal fat it's interesting. I'd have to go look at like medical research about that. I've never seen anything about it, but the fat there is it's kind of like different than other fat. It looks different. It has like, so I think that like, while I'm sure you could, I bet it would be a little bit like spared as well if I was just gonna like offer like some conjecture.
Awesome. Well, thank you. So all in all, thank you so much, Dr. Fakeway, for this awesome event. Thank you to everyone who asked questions. And also, just in general, thank you for your attendance today. Thank you, Tyler, for moderating the chat, as well as Rain and Nikki here for our ASL interpretation. If you'd like to stay connected, I will drop Dr. Fakeway's information in the chat. We will also have this event on replay on our blog, which will also include Dr. Fakeway's information and all the resources mentioned here to get today. I do encourage you all to stay connected with Point of Pride by following us on social media at Point of Pride ORG and subscribe to our newsletter to get information about all of our programs as well as when they open for applications. Remember, if you'd like to support our work, donations can be made at the link in the chat or texting Trans Futures to 44321. And before we end today, I want to remind you all of another programming coming from GCC continuing on today. We will be having Dr. Mosser talking about top surgery in just about, I believe it's either in a half hour or an hour.
Oh,
You can
fun.
check out our blog to sign up. Yeah, it's been great. We've had 3 different surgeons now come from GCC, so it's been a really great time working with you, Dr. Fakeway, as well as everyone at the center.
Glad to hear it. Yeah, we love it. You were with Dr. Lay last week, right?
Yep. We talked to Dr. Lay, we talked to you today, and then we'll talk to Dr. Mosser in just like, I think it's maybe an hour.
Yeah, I'm gonna go in his office and see.
Yeah. Awesome. Well, thank you so much. Again, thanks everyone for attending. And I hope you all have a great Trans Awareness Week.
Yeah, you too. Thank you.
Of course. Bye bye.